If you're ready to unlock more better days, to take control of your health, to push past your limits and unleash your full potential, then you're in the right place. I'm your host, Dr. Jeremy Bettle. For over 2 decades, I've worked with elite athletes and high performers, helping them optimize their bodies, strengthen their minds, and recover from setbacks. Now I'm bringing that expertise to you through the Vitality Collective podcast. In each episode, we'll dive deep into the science, strategies, and real-world solutions you can apply right away. Whether it's enhancing your physical performance, avoiding or recovering from injury, sharpening your mental edge, or simply feeling your best every single day. With insights from top experts and thought leaders, this podcast is designed to help you take action, feel better, and live the life that you deserve. Welcome to the Vitality Collective podcast, where every day is vital. Today, I'm joined by Dr. Nick Caropino, Director of Rehabilitation for the Atlanta Falcons and a world-class expert in sports rehabilitation. In this episode, we dive into the mechanics of hamstring injuries, how elite-level athletes are turned around in record time, and what the rest of us can learn from those in high-performance environments. You'll hear about a 6-day rehab that changed the course of the MLS playoffs, how sitting too long could be your biggest enemy, and why movement, not rest, is the key to recovery. If you've ever struggled with nagging hamstring pain or want to bulletproof your body for long-term health, this episode is a must-listen. Let's get started. Today, it's a real pleasure to welcome my friend Dr. Nick Caropino to the show. He's the Director of Rehab for the Atlanta Falcons. And for a bit of context, when Michelle and I were talking about doing an episode on hamstrings, one person came to mind, and that was Nick immediately. And the reason for that is together we did one of, I think, the most interesting and fun rehabs that I've ever done with an athlete. And so we're in MLS Cup. We're absolutely freezing to death up in New England. And one of our star center backs tears his hamstring. And I think they later confirmed it as a grade 2 strain, which would typically be about a 6-week rehab. The only problem with that was we were in playoffs and we had 6 days to turn it around. And so we sat down that night and we're like, okay, what if we just get him running tomorrow? And Nick was like, okay, let's give it a go. So that's what we did. And next day, I think it was 86% of his max velocity we got out of him. And so we got him on the field, we're running, everybody's looking at us like we're crazy. And that rehab went on throughout the week. He played full minutes the next week, played every minute of the playoffs going forward, and then we won MLS Cup. So, Nick, I thought of you right away because of that, and I really am excited for this conversation. Welcome to the show, mate.
Yeah, thanks a lot, Jeremy. Great memories with that one.
Yeah,
So happy to be here with that and talk through that. A stressful time, but a great time, a great outcome for us.
that was the first time I'd done a rehab like that. And it actually came out of a conversation I'd had with the Patriots performance director, Johan Bilsbro. He and I had a coffee earlier in the day, and he was just saying, we have such a short time to turn these guys around. I usually just get them running right away. And
Yeah,
then
no doubt.
we sit down and it's like, okay, all right, let's give it a try. What was your thought process as we started planning that out? Like, how did you sort of decide where we were going to go with all those different sections?
Yeah, I think there's a multitude of factors. First we needed to understand the grade of
Yeah,
what we were dealing with, and at the time, understanding, he has a low grade 2, grade 2A, depending on the scale we were using at the time, the BAMIC scale, and that was just step one. Understanding the athlete. This
yeah,
guy in particular is a hard worker, a guy who grinds through it. He's someone who wants to be available.
yeah,
So that was a factor. All of these had to hit to even take this opportunity. Our third one was the position. He's playing center back, but he's also playing a six,
right,
and if he gets the opportunity to play six in the next round, then we can limit high speed just due to the positional demands.
right.
And he's good with angles. He's good with understanding his body. And another one that I constantly thought of was just the style of runner that he was. He's a
Mhm.
low to the ground runner, almost like he's skating. His
Right.
turnover is his backside action isn't aggressive.
Right.
So, you think of all that, plus he's got the good muscle bulk and all this. Man, maybe we can try this, maybe we can go
Yeah.
for this. We're gonna go for this. He wants to do it, we want to do it. We're
Yeah.
trying to win a championship. And of course, on top of it, you're you're dealing with an organization for the first time ever going to the conference final
Right.
with their homegrown superstar is the guy we're talking about.
Yeah.
So it was kind of the perfect storm for us
Yeah.
to write a movie ending, you
Yeah.
know?
It really was. So I tell this story all the time, just about how unusual the whole situation was, and just how well it came together. Once we had that plan and we had buy-in from the athlete first and foremost, all of our medical guys, our strength staff, and then management. I think how it played out, and then to go on and win in penalties up in Portland, there it really was like fairy tale.
Oh yeah, absolutely.
So you mentioned a lot of different terms there as we start thinking about planning that rehab. And I want to start coming back to the basics for people. We're going to discuss hamstring health. Can you give us a little breakdown of the hamstring anatomy? Because it's quite a complex muscle group.
Yeah, it is. It's one that we constantly deal with this. It's always going to be the highest number of injuries across sport, whether we're here now in what I do now or in soccer. We're talking semitendinosis, semimembranosis, bicep femoris, right?
Okay.
And our attachments up in the ischial tuberosity down to the back of the knee, front of the knee,
Yeah.
lateral fibula. So we're talking hip to posterior knee attachments.
Right.
Um, and what we deal with from a biomechanical standpoint is knee flexion, hip extension, right?
Yeah. Pretty rare in this muscle group, right? Like it's not everywhere in the body that you have a muscle that crosses both joints at either end. Usually they're anchored at one end and they create movement at the other. But this will
Yeah.
actually create movements at both joints, the hip and at the knee.
Yeah, the hip and the knee, and what they're trying to do from produce force, slow force down, depending on what your philosophy is, what you believe in. There's so much back and forth on how the hamstring's involved in sprinting. And, there's that extra factor of even the bicep femoris, not to get too detailed, has a long head and a short head.
Right.
So short head
Right.
attaching lower on the femur and causes a lot of problems with
Yeah.
T-junction issues between lack of blood supply and what do
Right.
we think this actually does? You
Yeah.
know, and it's why we train it so often, right? And it's
Yeah.
why we talk about it so often as how important it is. But the reality is we still don't have it quite figured out. There still isn't the greatest answer for what gives us this bulletproof hamstring for two times body weight strength or whatever that may be.
Yeah.
These injuries are still occurring in these
Yeah.
elite level athletes and in our everyday population.
Yeah. It's such a challenge, isn't it, when we start talking about the injury prevention systems? It's it fascinates me because preventing injuries is actually an organizational problem, right? It's not the PT with the hamstring and the athlete, and here we go. I got the best plan. There's so many factors that you have to layer. We talked about them with James, right? Logistically, you've got to have everybody on board, from the travel schedule to the sleep schedule to the strength coach, the PT, the athletic trainers, the coaching staff. They've got to let you modify. The GM got to be involved, and all of that's got to come together into your injury prevention strategy. That's before you've understood the physiology and the anatomy of the muscle group you're actually working with.
No doubt. I can't stress that enough that the amount of pieces that need to go into that.
Yeah,
You hit it on the head. Everyone thinks from the outside looking in that this guy pulls his hamstring or oh, what's the medical staff doing, right? Or how
yeah,
is this happening when in
yeah,
reality the only way that a rehab goes well or that guys stay on the field is your nutritionist is there, your ATs are there, your PTs are there, your strength coach, your sports scientists, your
yeah,
positional coaches.
yeah,
Your ability to flex a schedule, right? That
Huh.
we think this may be more optimal than that for a particular player for a particular week.
Yeah.
Everyone has to be on the same page for you to get those types of outcomes.
Yeah, and it's really interesting because I'm coming out of sport now and seeing those same conversations. So the high performers that I work with are they're on Wall Street, they're investors, they're you name it, right? They're functioning at an elite level, but it doesn't involve them sprinting down the road, right? What it involves is them sitting for 10, 12 hours at a time. Yes, we can fix a hamstring tendinopathy. Yes, we can rehab a hamstring, but not if we can't change the surrounding systems. Like if you're going to sit on it for 12 hours a day, the 30 minutes of PT you do is probably going to be minimally effective, right?
Oh yeah. I can say that for, we'll talk about, greatest example is in the foot. We'll do these
Yeah,
foot exercises, right? Is that going to outweigh the 7,000 high speed steps you're going to take out on the field today, this one session, right?
yeah,
In the same sense with exactly what you're saying, is that 30-minute, that hour gym session going to outdo the 12 hours that you then go and sit and create this new problem? No.
yeah,
That you're not at a optimal ecosystem for success,
yeah,
and it's funny, I'll never forget, a simple example to that is my neck hurts. Well, you maybe all you need is a new pillow, right? Maybe your just system isn't
yeah,
set up for success.
yeah,
Sometimes it is that simple, and sometimes it's the James hamstring situation, and it's really complicated.
yeah,
So you really
yeah.
have to figure out what's the root cause of this
Hmm.
instead of rehab this over and over and over. Let's try to get to what's caused this in the first place.
Yeah. So let's dive into that. One of the most common problems that I deal with is this high hamstring, this proximal tendinopathy, and how that's presenting for people is a very focused area of pain right at the insertion. So you've got these two bones right basically under your butt. And that's where all of your weight comes through and your hamstring attaches in there. And we've got people just sitting right on that. And
Mhm.
worse when you're sitting, warms up with activity, but can be really debilitating, really painful. And so, can you describe a little bit of what might be going on there for people?
Yeah, absolutely. I think you could think of it as simple as constant compression just isn't good for the tendon in general,
Right.
right? So the tendons already get less blood supply than your muscle or even your muscular-tendinous junction. So constant compression creates adaptation, i.e., callus, that
Hmm.
you're not necessarily looking for in a proximal tendon in something that has to work often.
Yeah. Yeah.
And that's just if we take it all the way down to what's actually happening when I sit,
Right.
right? But what else is happening is hip flexors are getting tighter, glutes are getting weaker. This lower cross syndrome, per se,
Hmm.
of my paraspinals in my back are active, are tight, and my hip flexors are tight. My abdomen is weak, and my glutes are weak, right?
Hmm.
So now we have this compressed tendon that's struggling to get the hip into extension because its hip flexors are tight, because its
Right.
hamstrings and its glutes are weak, and then we're just going to constantly sit on that again, creating this constant pressure through this tendon that's trying to lay down flat,
Mm.
but just creates this callus and creates this bundle. And in turn, leads to a problem that is not as easily fixed, right? Because unless you can change the dynamics of what the job is, or give a person an understanding for needing to switch work environment, or you know, we tell people, well, you got to fix your posture. Well, of course, you can't just all of a sudden, boom, yeah, right. The real answer, when you say that, is understand when you're not in that position,
Hmm.
right? Not that you need to live in this perfect position all the time. Understand when you're not in it and be able
Right.
to adapt to that and
Right.
change that so you don't create this issue.
And I think that's where that environmental piece comes in as well. Like if we say, okay, you've got to fix your posture, but let's say you've got your screen set and it's at your navel height, and so you're looking down at your screen the whole time. your environment isn't going to allow you to have a great posture. And I always describe it to people like that. The body just hates being in one position for a long time. It's not that
Hmm.
flexion is bad or extension is bad. It's just that you don't stay there for a long time. So trying to get people moving a little bit. But you mentioned the root cause. Let's try and get your environment set up where you can be optimal.
Hmm.
And then it's almost like meditation, right? If meditation is just reclaiming your attention, same thing with your posture. You're not going to maintain it all day. But I love what you said on just notice when you're not in good posture and correct it.
Yeah,
It's like,
and that's
so good.
and that's the idea that it's as a therapist or as a practitioner at any level is that's an educational component
Yeah,
that you have to get through to them.
yeah,
And whether it's your executive or your athlete, right? I
yeah,
love what you just said. Most of our athletes' worst day is the day after a day off
yeah,
because they did nothing, right?
yeah,
You sat in one
yeah,
spot all day.
yeah.
And your executives are sometimes they don't get the choice, right? That is
Right.
the job. But you're right. There are environmental factors that you can change. There are things in your control, whether that's the desk or
Yeah,
how often you're just changing position
yeah,
is important, like you said, for you to realize it, especially with these guys that
yeah,
work at a computer, get in a zone,
yeah.
and all of a sudden you just don't realize it until you've created a problem.
And that's a parallel that I don't think people know exists between your executives and your elite athletes. Is that, when I was in NBA or NHL, they're only allowed in the building 4 hours a day. Right? That leaves them 20 hours to go home and sit down and play PlayStation. Right?
Mhm.
Because they're not going out and going to the gym. They're not working out all day or thinking about, oh, I should probably be stretching or I should probably be moving.
S- Yes, same problem. And sometimes we overlook the simple solutions. Lumbar roll or just
Yeah,
posture, right? You just assume that people know that because it's probably, at least in my profession, it's the first thing you learn, right? And then over
yeah,
the years,
yeah,
you just all of a sudden assume that this is second nature when it's really not, even at the
yeah,
highest level.
yeah,
So you're right.
yeah,
You're spot on with it doesn't matter. The executive versus the pro, it's you're dealing with the same problems.
yeah,
The only difference is likely that pro athlete, you're seeing them 7 days a week, where your executives kind of, the guys in the gym probably
yeah,
have days off in between. But other than
yeah.
that, the the issues that you're talking about come up regardless.
And so, if we build a framework for people, as people listening, they might recognize some of these symptoms that I'm describing. And I think it's important for them to have a framework if they do. Okay, so we've got to get you sitting. I usually recommend about 50% less. And that could be move over to a couch that's much more cushioned, or it could be, okay, I know you've got to sit and focus for these 2 hours, but have a standing option. Just pick your laptop up for when you're done. So if we can change the environment, that's got to be baseline, number one. Where would you go next for this person who's dealing with this issue? Let, let's sort of talk about some of the stages that we'd like them to go through to really knock this thing out, because they're pretty persistent. Like, these are long-term rehabs where I think people have been told that they might be easy and you should be done with this in 6 weeks. But
Mhm.
I tell people this is actually 6 to 12 months that we're going to be working you out of this.
Yeah, I think you're right. I think once you've created that problem in a robust tendon and in a complex part of the body, you're talking about needing to remodel a tissue at a high level that it would be easy if it was just a strain while you were playing basketball.
Yeah,
That as quickly as it came on, it will be as quickly as it goes away,
yeah,
over your 4 to 6 weeks. But for this, you're needing to break down and rebuild tissue again.
hmm,
So what I would say is back to what we talked about before is what do we think the problem is after we've solved this is a environmental thing that we've changed your desk height or we've changed your ability to move around is let's fix the what's caused from the sitting, the like we talked
Hmm.
about, the hip flexors. Let's
Yeah.
talk about the are the glutes even working? All right, so many people just don't truly activate, quote unquote,
Yeah.
activate glutes properly or have a
Yeah.
proper strength and conditioning and mobility program, right?
Right.
As many as much as there are so many new things, it's the
Hmm.
foundation of the simple things
Yeah.
of, strengthen what's weak, stretch what's tight. Let's try to normalize this foundation, right? The
Yeah.
pelvis, the
Yeah.
foundation of the house, so that everything else works well around it.
Yeah.
And I would say that you would need to get on a version of a program like that, and and work around the issue first, and then let's start to progressively overload as you've improved through this tendon so
Yeah.
that number one, you maintain the buy-in
Yeah.
and also that you see the progress over time, And look, if you get the third option to be able to dabble in improving your overall healthy diet as well
Yeah.
as improving your intake of, I couldn't preach enough about collagen
Yeah.
and tendon health.
Yeah.
That's going to go miles for anyone, not just a high level athlete, anyone who can get on that. Then you are probably talking, if you could say consistent, a 6 month ordeal. It would still probably take you that long,
Yeah.
but you can get out of the woods,
Yeah.
but it won't be without being consistent, without having practitioner not just treat that tendon, treat everything that's around that tendon. That will in turn help treat the tendon and then just reinforce.
I want to talk about
Mhm.
the breakdown and remodeling of that tissue because I think that's a really important piece. That what we are actually doing is we have to load that tissue, and in that acute phase, when we first start getting into it, we can actually see a bit of a spike in symptoms, and that's really scary for people, and leads them to want to back away from actually doing the exercises they need. And
Mhm.
it's taken a lot of conversation and a lot of counseling through that period of it's okay if this hurts, so long as it comes back down. We can't get this going up to a 10 out of 10 pain and staying there, but we might feel it a little bit. We might experience some pain for a couple of days. Can you speak a little bit to that breakdown and remodel process that they might be going through?
Yeah, and I think you're right. And I think that's to what I said previously is, that this is going to be a part of that process.
Yeah.
Is things might get a little bit worse to be able to improve.
Yeah.
And so treating things around that area first will ideally get your buy-in from your client,
Mm.
and give you the time to explain. Like, look, this is what we have to do here. And in layman's terms, right, is we're trying to take a chronic tendon now that is bundled and try to get it to lay smooth again. And the only way to do that is to stress that tendon.
Right.
And when we create that stress, we cause the tendon to break down and remodel, just as
Mm.
we do with every tissue. And
Right.
that sounds scary, but that's what you're doing when you're lifting weights, right? But you don't think of that. And
Right.
clients, you might not tell them you're tearing your tissue every time because it
Yeah.
rebuilds stronger, right? It's sometimes that's too far in the weeds,
Yeah.
but it can be that simple. Even now, when I try to explain it to anyone, is just using that simple understanding of we got to break down an old callus, and
Hmm.
we're trying to relay smooth tissue beyond it. Now, to do that, we have to break through that issue, right? We
Yeah.
have to progressively overload this tendon. We have to put this tendon in an environment that elicits a reaction because
Hmm.
that's the only way that we can produce change,
Yeah.
So
Yeah.
I think that's an easy conversation once people just understand, look, we have to, this isn't about getting you to feel better in the
Hmm.
short term. This is
Yeah.
about creating a reset through your body to feel better in the long term. This
Yeah.
is a process. This is a book, not a short story, that
Yeah.
we're trying to go through.
Yeah.
And I think the little bit of understanding that they can have with that is great without going into this type of collagen versus this type of collagen, helps works here or there. I think that's probably a conversation for some of your clients, maybe, but
Yeah,
not everyone, other than just understanding we have to break tissue down, and to break down a tendon tissue that holds your muscles together, allows you to produce all this force, generates force, connects your tissue to bone. It takes significant load to be able to do that. So
yeah,
you're going to have to go through a high stress environment to create that adaptation.
yeah. And I think that's the important thing is, the collagen and your fibers within these tissues, they lay down in the line of force, right? So if we don't apply that force through the tendon, it sort of doesn't know which way to form, right? It's really
Right.
hard to organize in a direction if we're not really pulling on it. And
Mhm.
I find these to be relatively easy conversations until somebody's back in pain.
Mhm.
Right. That's always where we have to like have a bit of a reset on our program is when they get a big flare up or when we do something and we change the program and it gets worse for a period. Now it's a more difficult conversation because when people have been in pain for a long time and they experience a decrease but then go back, it can be a really scary thing for them to feel like, okay, well, here we are again. I've done it again. This is just what it's always going to be,
Mhm.
and that's a difficult period for people to navigate, I think.
Yeah, I agree. And I think that's where you need to probably have some quick wins or some quick hitters in your pocket. With the setting I'm in now, the conversation is always, look, the strength and the running and all this hard work is going to get you where you need to get. But we also have the feel good, the
Yes.
shock wave or the
Yeah.
soft wave or the soft tissue work
Yes.
or this, like, that is going to make you feel better. That is a small victory for a practitioner, but the understanding needs to be the work is what's going to get you there. But if you don't have that tool of what can I get that just makes them feel better,
Yes.
then you're right. You could lose them. And
Yeah.
maybe that's as simple as heat or contrast or cold or some friction work, something, even quick manipulations. I like to
Yes.
say, make sure you have a couple of those in your bag to all
Yeah.
practitioners. Even if this isn't going to be what is your end all be all, the neck pain person's going to feel better probably with a quick little, thoracic manipulation. And then you
Yeah.
get back to work by reinforcing it with what the actual issue is. So
Right.
I think you're dead on it. You can't expect someone to come in, do all this stuff that potentially makes them worse, then go stand at work, right? Can't sit
Yeah.
down because also you've preached that they can't do that, and
Yeah.
expect everyone to buy in. Some people are,
Yeah.
you're right. Pain is frustrating,
Yeah.
and
Yeah.
you need to have short-term wins to get to long-term goals.
Yeah. So you mentioned a couple of really important things. I think that first of all, I was grinning when you were talking about the foundations because we just hammer that on this show, and I hammer it with my clients that there are just things that won't go away, right? Doing work, eating well, sleeping, having connection, all these things are just going to make you better. You've layered in the nutrition. I think that's a really important conversation around collagen, and there's a few little supplements, but I want people to understand that that doesn't necessarily speed up the process. It gives your body the right building blocks to augment the process and to make it better, but it's not like it's going to cut your rehab from 6 months down to 3 months. I think the next layer that you've mentioned are these modalities, right? The passive, you lay on the table, I'm going to hit you with a shockwave device, and we're going to do this to help facilitate some of the work that's below. I always looked at it like you have to be sort of out of pain so we have access to this foundational element. Where do these modalities fit, and which ones have you found to be impactful in rehab? Because there's going to be all sorts of things being sold to you from from different corners of the market.
Yeah, I think you're right. Those the modalities are the things at every conference you go to, right? They're the what's new. Like I talked about at the beginning, what's the boring answer that's actually right? Building the strength, right? Having the mobility, eating right, sleeping right. But everybody's already heard that. They want to hear what's the fancy new
Yeah.
thing I can lay on or thing that makes noise. The amount of things we have that make noise would just drive you crazy. But I do think that they're valuable, but they're not your foundation,
Yeah.
right? And they all work for a minimal percent.
Right.
I think we can gain 2 or 3%. For example, soft wave or shock wave on tendons, I think is great.
Hmm.
For general muscle soreness, contrast is fantastic. I think it depends on the situation that you're in, on what modality works best for you, dry needling,
Yeah.
etc.
Yeah.
Uh, in our setting, it's based off of a high day or a low day, or how are you presenting? Are
Hmm.
you stiff? Are you heavy? Are you irritable? Are you tired? Right? We use this framework, this shit framework, right? And based on that, that dictates the modality that we should use.
Yeah.
Maybe your recovery modality is a lift,
Right.
So
Right.
I think it depends on how the athlete is presenting and how the general population is presenting, which way to give direction. Game ready is your common hot and cold modality, but that's not the answer for
Mhm.
everything. The ice isn't your answer for everything.
Right.
Am I going to give ice to a chronic tendon? Probably not.
Right.
Did we, unless we cause an immediate stress that has created its adaptation, and then we're further, maybe we're 48 hours removed, then we could talk about it. But I think you have to be cautious in that. In the
Yeah.
same sense, is there's also we could go all the way back to ultrasound, right? The placebo effect.
Yeah.
It's been proven ineffective. Placebo effect is proven effective. If
Yeah.
the person believes that it is working, then it is working.
Yes. Yes.
So you have to take that into account, as well
Yeah.
as if they feel they are getting better, which is a conversation that I think is good to have with a young practitioner. If they
Yeah.
feel they're getting better, yes, they're getting better. Should you understand the research behind what you're doing? Absolutely.
Yeah.
Right? But is it going to all come out of the textbook? No.
I want to hammer that point because that's sort of where our evidence-based colleagues, I think, as well need to hear this. Like, let's throw everything out that there isn't a meta-analysis that says this directly impacts tissue function in some way. But that's the case with recovery modalities as well. If the athlete thinks it's helping them recover, it's helping them recover. That's it. Like, there are certain things that, yes, they move the needle on physiology. Everything else after that is just like, oh, I really like this. It really helps me relax. Brilliant. Go do it. Because I guarantee you something else. It's probably not making you worse.
Yes. I was just about to say, none of those things are making you worse. And the question is always from our new guys, what should I do? And you're right, I'm happy to give direction. But then
Yeah.
it'd also be, well, this guy who's 10 years in does this. You're right, because he likes it.
Yeah.
He's found that it works for him. And that's
Yeah.
probably the biggest thing. Find out what works for you.
Yeah.
You're not as simple as the analogy of the car, right?
Yeah.
Where you bring in the race car, they know exactly how to fix it. It's not as
Yeah.
simple as that. We can give
Yeah.
you that, but some things work better for others.
Yeah.
And if you
Yeah.
believe it and you feel better, do it because it's not making you worse. Exactly.
I use this all the time, but we had Patrick Marlowe, who was about 22 years into his NHL career when we got him. And he had figured out that he would come in from warm ups because they skate for 20 minutes, come in, and then they get ready to go out for the first period. He would strip down and go and get in the cold plunge. And he would sit in there up to his neck for 5 minutes. He would get dressed again, go back out. And he would do that at every intermission. right? That worked for him. Brought his
Mhm.
core body temperature down, which we know has the physiological effect of boosting your performance. Okay, great. Can you imagine if we went over to soccer and you take this young kid who's just come out of like Uruguay, right? And he's just been playing, at his local club. And we're like, okay, we're going to throw you in this cold plunge for 5 minutes, like right before you go play. Like,
Right.
not a chance. You're doing way more harm than you're actually helping him there.
Oh my gosh. Yeah. I'll tell you, I would love to know one day how many of these guys' recovery strategies were based around a specific individual performance that they had on the day.
Oh,
You know, that
100%.
that
Yeah.
lasted for 10 years throughout their
Yeah.
career because they did things a certain way.
Yeah.
And I think some of them will admit to it because you all have OCD, right? You all have your little tendencies of
Yeah.
I step on the field with my right foot first, I whatever that may be. I
Yeah.
needle on Fridays. I do this on Saturdays.
Yeah.
And
Yeah.
great, right? Because that works for you. That gets you in your
Yeah.
headspace. So
Yeah.
yeah, to go full circle, we could go all day on what the science says, but it may not work for everyone.
Hmm.
And we should at least have an understanding of what it is,
Yeah.
before we go giving it out. So I think that's the thing is find out what works for your people the best and
Yeah.
then use that, and make sure you're hitting on the big things, right? The nutrition, the sleep. You can't miss on those. Those are the ones you can't miss on. If you miss on the little guys, that's okay.
Yeah. So that sort of brings me, you've mentioned a couple of times the tendinopathies and strains, and we've sort of gone between the two things there. And one of the things that gets brought up often during these flare ups or when people first come to me is I've injured my hamstring, right? So they're thinking about a tendinopathy like they're hearing about one of your guys on a Sunday running down the field and pulling up with a hamstring injury. And what would be the difference between this tendinopathy and a strain? Just so people can understand the mechanics of did you actually injure the tissue doing something?
Yeah, I think the simplest one is mechanism. It's
Hmm.
so often that we will see the sprinters, have the sniper episode or where
Yeah,
they kind of get caught and they fall. Um, so the mechanism is important. And
yeah,
a strain is more often than not, I can't think of an example not of you're going to have well, tell me what happened. What's this acute episode that occurred in your life? Where a tendon is a gradual onset for a tendinopathy
hmm,
is for especially for what you're dealing with. We're talking, yes, there's acute and chronic, right? Tendinosis, tendinitis, however we want to talk about it, is there are acute onset flare-ups of tendon issues, typically with a mechanism, but you're over time, your gradual, well, now all of a sudden I think I have a hamstring strain
yeah,
is without an episode, you're probably thinking, okay, this is something that is either worn over time
yeah,
due to a constant stress that has been low level
yeah,
compared to aggressive, or do we need to look somewhere else? Where do we think potentially that this is actually driving from,
yeah.
that you're thinking this just because you may have seen it on TV or heard it from, you know, Adam Schefter or whoever it is.
Hmm. Yeah. And I think the mechanism, if we go actually to the muscular level, you mentioned tendinopathy, the fibers of that tendon just becoming really sort of disorganized and sort of balling
Mhm.
up versus a strain where it's actually like a mechanical tearing, going from a strain, which is sort of a small amount of tearing to a full hamstring tear where we're actually seeing some bleeding and separation. So I think that would be for me like that didn't happen when your tendinopathy flared up again, right? There wasn't a tearing of the hamstring because it those are high force events, right? You'd have to have been doing something pretty extreme to get that much damage to your hamstring.
Yeah, 100%. I think that's why the subjective is so important. Without that mechanism, you should look somewhere else. Like you're saying, maybe we have an acute flare-up of a tendinopathy. It's very it's not likely, right, that I woke up the next day and I have a hamstring strain, right? That's just not happening. You
Yeah,
know,
yeah.
we need to find a different cause here.
And then the other thing that's tricky about hamstrings, and we found this a lot, and again between athletes and high performers outside of sport, is sometimes that dull ache that you can get in the belly of the hamstring actually isn't your hamstring at all. And
Hmm.
it might be a neurological issue that's referring from the lower back maybe, and it's more of a sciatic sort of pain.
Hmm. Yes, and you're right, and those present very, very similar, and will trick even the most experienced practitioners because the referral pain of the sciatic nerve is along the hamstring,
Yeah,
and it will present vaguely similar. And we think about the nerve is when it's on stretch with the hip flex and the knee extended is the same as when the hamstring's on stretch. So yes, is that going to make it worse? Absolutely.
hmm,
So you are talking about, well, this guy, is hiding, this nerve is hiding and presenting as a hamstring,
yeah,
right? And diagnosing that will come down to, like we just talked about, what's the difference in our subjective here? Do we have an episode versus not? But also, a clinical eval is going to be important, checking the foundation, checking the low back, and also recognizing that two can be the same. Even in an acute episode, there are possibilities of nerve irritation as well. So
yeah,
you're talking
yeah,
about treating two things at the same time,
yeah,
potentially in acute setting, where in a chronic setting, you'll probably find, yeah, this just comes up over time. Now I'm getting this pain along my hamstring that when I use it, it feels like a hamstring strain. No
yeah,
doubt. Yeah, I'm with
yeah,
you.
yeah.
But, our solution isn't get the hamstring stronger.
Hmm.
You have this nerve issue because let's bring it back to the foundation. Something in the foundation is off,
Yeah.
to where now this nerve is stressed, it's compressed within the piriformis potentially, or maybe it's coming through the lumbar spine. Where is this nerve irritated?
Mm-hmm.
And how do we fix it? There's oftentimes, to jump into how big of a deal this can be, even from the pro athlete setting, think about this, constant hamstring strains.
Yeah.
And guys who constantly deal with a hamstring strain, who go through the proper rehab, who meet the two times body weight, who have great running mechanics, could potentially have a nerve issue. And if we know the nerve is like a piece of floss that doesn't want to be stretched.
Hmm.
And again, we talk about it's stretched by being in hip flexion, knee extension. If that nerve doesn't want to be stressed and stretched, it's going to actively, from your neural pathways, cause the hamstrings to stay tighter
Hmm.
to help that. And then you sprint and boom, hamstring strain, right?
Right.
Rehab the hamstring, back to playing, boom, hamstring strain again.
Yeah. Yeah.
Well, what is the actual problem here? Potentially this is a nerve issue. So
Yeah.
to go full circle on that, even at the highest level of sport, that nerve is tricky
Hmm.
and presents and creates its own version of a hamstring strain where, our normal clients, from just sitting, maybe it's worse when I sit, right?
Yeah.
Okay,
Yeah.
that leads me immediately to the low back.
Yeah.
It gets
Exactly.
better with just activity. I don't feel it as much, or it moves on me.
Hmm.
Those subjective keys are important to understanding how you're going to treat that.
I think that's an important thing. Is if people are listening and they're like, "Well, I wonder how would I know if mine's a nerve thing?" For me, it would be the difference between having a very, very focused point at the insertion of that hamstring, right on that sit bone, versus an ache sort of that's a little lower down, that like maybe it's mid belly, maybe it's moving around the back of that thigh, where it's a little less focused. But again, there wasn't necessarily I was running a route on a Sunday and, you know, popped my hamstring. There wasn't a big event like that, but it's more mid belly. I think
Hmm.
that that's how I would generally describe it to someone. Are there other factors that you might consider for somebody who's sitting listening to this and trying to decide which theirs might be?
Yeah, I think you nailed it with the vague change in symptom. The tendon is going to stay and the nerve is likely going to move.
Yeah,
So I would say those are your big keys. A proximal tendinopathy is going to bother you with compression, and now the nerve still might bother you when you're sitting just because of potentially where this nerve is compressed, right? Which is what makes this so challenging to diagnose at home because you need to know where this nerve issue is coming from.
mhm,
But what I would say to people listening is just if you're not sure, right, and you think this is moving around, like today it's in my glute, now it's in the back of my leg, like where is this hamstring strain? That's likely going to be nerve, where if you're with your proximal tendinopathy, you could probably grab it. You could
yeah,
probably feel that. And you're like, golly, like that's it, you
yeah,
know?
yeah,
So that would be the easiest way to self-diagnose per se.
yeah,
I never want to tell someone, you know, well, if it's the nerve, it's coming from the back, and this is how you fix it, right?
yeah, yeah, yeah,
You're driven by, Mulligan or by McKinsey, or, you're going to find practitioners that are set in one way, and that's how you do it. And I don't
yeah,
believe in that, so
yeah.
I very much won't tell you on this podcast how to fix it,
Come on, we need
other
these
than,
things. Like, tell
yeah.
us.
Which, man, if I had that, that'd be great. But
Yeah,
until then, I think it's what makes this so challenging, is
yeah,
it's a multitude of things.
yeah,
It can, especially with the chronic issues, is it's building, 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 and then it's present.
yes,
So it's going to take that much to get this to go away because
yeah,
this has been happening and you just
yeah,
didn't feel it until
yeah,
all of a sudden you did,
yeah,
and that's what's so frustrating.
yeah. And I think that that's a really good place to shift into this rehab phase of this, and how we take these things that might be potentially different causes to what ultimately presents as more or less the same problem, hamstring pain. We talked a little bit beforehand, and you and I have talked at length, when we worked together about this, but the rehab process itself should sort of incorporate all of it and may not be all that different once we really get through acute sort of differential diagnosis of the problem. Can you
hmm
walk us through those steps a little bit on what a good return to play or a good, you know, pain free and past the injury rehab might look like?
Yeah, for sure. I think you're right. It's not reinventing the wheel. I think we understand, at least from the hamstring perspective, that we'll typically follow the pattern of isometric, eccentric, concentric,
Mhm.
and we like to stay closed chain and then open chain. So, but from a basic standpoint, from a hamstring, again, we're working back to glutes, we're working back to core. We're starting there, making sure that everything is working how it should be working. We're doing big movements, squatting, we're lunging. Yeah, those are simple that need to be incorporated right away, even with your hamstring strain. You know, when it comes to the injury itself, it's like we just said, it's very rare, at least here, that unless you have a bad hamstring strain, that you're just doing isometrics of the hamstring and that's it.
Yeah,
You're immediately walking in the pool, or walking outside, or you have some dynamic movement already. Where I always say, all right, once you're outside of the acute phase, you shouldn't be able to tell a difference
yeah,
between who's rehabbing and who's training in the gym.
yeah.
It should look relatively similar.
Think back to that rehab with James, and it was so compressed into a 6 day period versus a 6 week period, but he was running day one, right? 86% is a decent percentage of his max velocity. He went from the field into the gym where we had him doing eccentric hamstring extensions. So he's in the weight room loading that tissue the day after, like probably 12 hours after he sustained the injury. So I think that's really important. People get quite scared of moving and
Hmm.
of loading that tissue, even in a chronic environment. But it's very, very important, I think, that this is something that we move towards and we communicate through that initial period where people are starting to move.
Yeah, you're exactly right. I think movement is our biggest key, quite honestly. When we talk about a hamstring strain, the only thing that's being avoided is actually stretching. Passive stretching is pretty much the only thing we don't do. Day one, let's just call it a grade one hamstring. The guys are running immediately. They're going through a dynamic warm up. We're doing hip dominant, knee dominant. What do I mean by that? Bridges or hamstring slides or glute hams or RDLs. What can the what can the guy tolerate to a 3 or 4 out of 10 level? Because we're immediately remodeling, right? We have a tissue that has broken down and we need this to relay correctly.
Yeah.
So the message is always uh, we're not avoiding pain. We have a limit, we have a threshold here, subjectively, of 3 or so out of 10, but we want to work through everything that's tolerable,
Hmm.
So with James, that was where we got to, was
Yeah.
86%. If we would have had 2 or 3 more weeks, we probably would have capped his running percentage,
Yeah.
just to be
Yeah.
safe, to not push the limit. But so with a guy here, we might go through multiple phases of running from just a reintroduction, 50 to 75% of your max, right? Then build off of that. Make sure mechanics look right. Build and build. At the same time, with how are we progressing, how we're loading in the gym.
Yeah.
Isometrics are great, right? Okay, then the bridge hamstring slides are great. Okay, are the RDLs great, right? As we progress that exercise, how is the player responding or how is the client responding? And that's going to dictate how we move forward. You of course need to understand the physiology behind the tear, depending on what grade they have, so you know what risks you're going to take.
Hmm.
But by all means, there's a immediate movement. It
Yeah.
is very rare that, and I would say not at all, that a guy's not going to be moving the next day following a hamstring strain.
Yeah.
If you avoid it, you're just delaying your return.
Yeah. And I think delaying the quality of your return, right? It's going to be more hard work later because to be clear on the instruction to James, right? We didn't just run out and say, okay, sprint down the field. It was I want you to run as fast as you can within a 3 or 4 out of 10 pain level, right? And similarly in the gym. And then within that framework of it, it's not that we don't want you to feel anything. You're allowed to feel something, but you will get faster within that 3 to 4, right? As the tissue is able to. And I think it's really important the overload piece you mentioned of getting stronger, moving faster throughout. You will gradually be able to withstand more weight and more speed. That's often the piece outside of sport that's missing, where people don't have access to you and your team of people to manage them through an entire return to play. It usually stops when their insurance cuts them off from PT,
Hmm.
which is pretty much did it stop hurting? And so what should that next piece for people look like? It stopped hurting. They're in the gym. They're doing some exercise. They're not done though, right? Like that's not the finished product if they want to get back to doing the thing they love.
Yeah, that's a big problem in healthcare therapy, that we could talk on all day, is the lack of resources at the next level or the ability to stay in the clinic, but or even if you can, the practitioner level needs to be high enough to be able to take you to that next level, where that's why it's so valuable, I think, for the outside client to understand that therapy is your new, you're at a new baseline,
Mm-hmm.
but you're by no means done, and you need a a routine or a gym or, access to strength and conditioning, to continued help. That's those clinics that are attached to facilities is strength and conditioning facilities are why you get better outcomes. Is you're trying to, with this issue, the idea isn't to get you feel better and send you back to work. It's to create a new habit. How
Yeah.
long do we get to create that new habit? If we only get 8 weeks to create that new habit in therapy, and then the other 44 weeks of the year you go back to your normal, then I'll see you next year.
Yeah.
And as the therapist, there's your business model, right? As a
Yeah.
poor therapist.
Yeah.
But at a higher level, it's education and telling them this is just the beginning of a new process for you.
Right.
That for you to sustain what you want to do in daily life, you're by no means done. It's very
Yes.
rare that therapy is taking you all the way through,
Yeah.
at any level. Just their insurance or cost or whatever that may be is just such a limiting factor
Yeah.
to produce those positive outcomes. So, the idea is if you're a strength and conditioning coach or a practitioner of wellness, is that you're tying into those clinics and hoping that that education is
Yeah.
being presented to them.
Yeah. Yeah.
That, when I used to work in private practice, that was the whole model was your ACL starts here, it finishes in the gym.
Yeah.
Your doctor's clearance is going to tell you that it's done early, but that isn't, you know, poor understanding from the physician. That's just saying you can go back to lifting,
Yeah.
or lifting at a high level. That those transition moments is where people get lost. It's where I think
Yeah.
people say, I tried therapy and it didn't work.
Yes.
That's how you end up in that gray area is without having a understanding of of what we just said of the new foundation. This is a new process. You've
Yeah.
just started it here,
Yeah.
and you need to continue this wherever that may be, your local gym or
Right.
wherever.
Yeah, I think finding that right professional and that group of professionals who can communicate, because that was one of the things that you and I set about doing when I came into New York, was it was all quite disjointed. And you and I sat down very early on and we're like, okay, how do we stretch this from the physician all the way through to the coaches and make sure that everybody's involved and everyone knows what's going on? Because it's not about just one of us. And then we can appropriately educate the player on as they increase their capacity, even if they're experiencing the same levels of pain, but they've moved from the table back onto the field. Look at what you can do. That's the important thing here. And the pain will go away, but you increase capacity within that and then get to that point where you've met the demands of the thing you want to go back and do in your rehab. Because I think that's where people fall away from the stuff they love doing is because they never quite get back there. Because they don't have that person to help them and continue their rehab back to pickleball, for example, right? And they
Right.
were never quite the same. They could never quite get back. And I think it's that fear of getting back or the misunderstanding from the doctor who says, okay, you're cleared. Go
Yeah.
ahead. And so they go from there to pickleball and now you've got a ruptured Achilles, right?
Right. Right. That's
Something
a
else.
hundred percent.
Yeah.
100% accurate. Just, talking like we did in the beginning, it's never, even for my sake, it's, oh, good job on this rehab, right? Sometimes you'll hear that, well, the whole team needs to be thanked here.
Yeah.
It does take every single person
Yeah.
and the proper transition from the table back to the gym. And you made a
Yeah.
good point is, you know, maybe you couldn't walk up the stairs without your pain, but then you could do that, right? And now you're back in the gym. You couldn't go to the gym with your pain. Now you're in the gym. You might still have
Yeah.
a little issue, but you're there. And then you're
Yeah.
back to pickleball. You might still have a little issue, but you're there.
Yeah.
And staying with that process. And I think you're right, is, there isn't a, quote unquote high performance model for the general public.
Yeah.
It doesn't quite exist. I think, like we talked about, places where, you have orthopedics tied to the physician, tied to therapy, tied to strength conditioning, even in their own building,
Yeah.
there are still gaps, but the idea is there. You can, if you've seen the model, you see, okay, I see what they're trying to do here, right?
Yeah.
But a standalone practice of any nature is going to have its limitations due
Yeah.
to either maybe it's lack of PT or lack of
Yeah.
nutrition or lack of strength and conditioning, right?
Yeah.
And that's where I think people don't realize how complicated this actually can be
Yeah.
and how much throwing one person at it is almost doing them a disservice. You're giving them something that they can't
Yeah.
do by
Yeah.
themselves.
Yeah.
It does take a village,
It really does.
to do it right.
And so then the connective tissue, somebody coordinating those pieces,
Yeah.
right? That's it's such a challenging part. That was my job as performance director, and it's what we've set about doing outside with Vitality Collective is building that system. But the challenges of insurance is going to cover this bit and not this bit, and your doctor's used to overseeing the whole thing, and the logistical challenges of putting this into the real world outside of sport are real. And so I
Hmm.
think it's very important that we keep persevering with it and we keep pushing the message and trying to bring groups of people together to coordinate, because the outcomes are just spectacular when you do see it. We've
Hmm.
got 85-year-olds, we've got 83-year-olds, 70-year-olds who are going from really debilitating conditions and surgeries and not finishing rehabs to going back to heli skiing and deadlifting and all these things that they love doing. And you're really transforming people's lives by coordinating their care and applying these overload principles to what they're doing.
100%. I think you're right. I think it's a gap, and when you can find it, when people are believe in it, right? Or can take the other thing is, taking your ego out of it, right? You don't need to be the only one here.
Yeah,
There's other pieces to this,
yeah,
that other people can see and other people can help with. And that is how you get your, 75-year-olds to feel the best they ever did.
mhm,
We used to talk about in the clinic that people getting total knee replacement, it changes your life
yeah,
because you dealt with it for so long, and then you have this new opportunity, right?
hmm,
And that's the same message that you're trying to give is you have a new opportunity. You're exactly right.
yeah,
What does that opportunity entail? Yes, it entails this therapy to get you out of the woods from a major surgery, but that's the beginning. You need to, whatever that is, the diet, or you need to be in the gym, you need to have your place, you need to have your people
yeah,
who can educate you on these things or give you the guidance on these things, because what we think about as no-brainers, the majority of the population just doesn't know,
right, yeah,
and then they
yeah,
miss or they stop doing what they love because they think they're too old for it,
right,
which I used to work with a strength coach who prided himself on that, on getting these older population as strong as they've ever been,
yeah,
just to prove a
yeah,
point that
yes,
that is
exactly,
old. Like this is not, this is a myth,
yes,
that you have
yes,
to just wither away.
yes, exactly. And that opportunity piece, I love how you framed that, because this is an opportunity for people. The pain is almost the gift that has forced them to shift their mindset and really restructure their lives around getting out of pain, which basically anything that gets you out of pain is good for your health, right? And
Right,
anything we talked about, you changed your diet, you changed your exercise habits, you changed your posture at work. All of these things are longevity interventions, ultimately.
right.
So, what an
Yeah.
opportunity that you can take out of this to come out the other side better, stronger, and with a new mindset. And I think part of that mindset should also come around the investment into your future,
Hmm.
because we're so used to putting down your insurance card and just having a copay that we're not necessarily thinking about, oh, well, yeah, but insurance doesn't pay for my trainer, or my trainer should take. insurance or this person should take insurance. But I think you're going to have to think about investing financially in those later steps right now because insurance just isn't covering.
Yeah, and I think that comes down to us to do the proper education. It's exactly right. What an opportunity you have to get access to now this new information and this new lifestyle to
Yeah,
where you're right. You want to say 15 years down the road, geez, you're in such great shape. What happened? I had a proximal hamstring tendon that never went away 15 years ago,
yeah,
you know?
yeah,
And it wasn't my trainer didn't just try to get this to go away, he tried to build a new lifestyle, which in turn got this hamstring tendon to go away. But
yeah,
now this is what's valuable to me. And
yeah.
there's definitely a shift in that. I think you're seeing more of these, health club designs that are
Hmm.
more open facing, more friendly, more trying to bring people together, trying to preach health
Yeah,
as something that needs to be invested in,
yeah,
because that is just, you have more access to it now, right? Like
yeah,
you can listen to the everyone who comes on your podcast, you can get information, and the information is out there, and people want to help people. And as a practitioner, you realize, gosh, I can help people without really reinventing the wheel on anything,
yeah,
but I just need people to buy into this,
right.
right? What if people have been doing for hundreds of years
Yeah,
and just get in there and get it done. So it is what an opportunity to go through an injury. Even here, we dealt with, a long-term injury, and what an opportunity to create a new habit for that
yeah,
player
yeah,
of how they prep, of how they recover, even an injury that isn't their fault, maybe it's a collision
yeah,
injury, but what an
yeah,
opportunity for you
yeah,
to create habits for the next 10 years,
yeah, exactly.
that you didn't realize were
Yeah,
important until you had to go through it yourself.
yeah. And that's often when we would first get a young player's buy-in. It was their first big injury. They had to put that work in and they went through this process and all of a sudden they start feeling amazing. That's when we typically get that young guy. So Nick, I've kept you way over the time that you promised. You've been very generous to come in on your bye week and sit with us and share some of your knowledge. As we wrap up here, what are the three takeaways that you'd like people to grab from this episode? If there were three things that we could go away today and implement in our life, what would those be for you?
Yeah, I think number one is, if you're the point we just hit on is one I could have talked about for days.
Yeah,
Is don't think about if you have a new issue or a new pain as just a burden, but as a chance for you to open a new door
yeah,
and create something different in your lifestyle, and know that there are people out there that want to take care of you.
yeah,
So from a big picture, I would think that that's a big one. Um, a second one would be, we talked on the hamstring and the rehab is for practitioners and for everyone is, you know, yes, there are going to be nuances in the way that we train, but these processes aren't reinventing the wheel. Your normal client and your pro athlete are both doing bridges when they train a hamstring.
yeah,
This process is the same. You have your own unique response and your own unique rehab, but the big pieces are going to stay similar, you
yeah,
know? And, a third one would be just off of that is what's important there are your nutrition, your sleep, your ability to exercise,
yeah,
wherever you're at in your life, whether you're exercising to pick your kids up or your grandkids up, or you're exercising to, stop whoever the quarterback is on Sunday, you need those reasons to do that, and those are important things though. Those big things when it comes to understanding that lifting and stress and adaptation is important, and the big ways of how to take care of yourself and do that are through
yeah,
sleep, nutrition, and proper training. I think,
yeah,
those are such simple things to take away,
yeah,
but are are the keys, and I would challenge anyone to say that it's any different than that. They're To
Yeah.
go on a quick tangent, there we talk more about in the hamstring rehab and incorporating rotation, right? And like that's a big new one for T junction and stuff like that. And yes, it's 100% valuable. Your big rocks are still in training, right?
Yeah.
It's active. It's
Yes.
you doing the work. It's you
Yes.
putting in the effort. It's you having your reason. I think that those are those are important takeaways for me.
Awesome. Those I can't add anything. Those they're exactly what we're pushing with people, and basically anybody who's trying to convince you that there's something that doesn't fall into that bucket of exercise, sleep, nutrition, maybe social connection, engagement, these sorts of things, is almost certainly trying to sell you something.
Yeah.
Right? Right? Wait for the sales pitch. It's coming. Right?
Right.
And buy my supplement. Right? Like,
Right.
no, I just love that, mate. And that's our whole ethos here with Vitality Collective. And Nick, where can people find you and follow along with your work and learn more from you?
Yeah, so I'm on LinkedIn, and that's probably the best place to just connect with me if you ever want to reach out, have questions. I got to where I'm at through LinkedIn and
Right. Right.
talking to people, asking questions.
Yeah.
Of course, there's my social media if you just want to see inside my normal life. That's more just that nature, but yeah, that's the easiest
Great.
way to get to me.
All right. We'll put your LinkedIn up on the show notes, and we'll have everyone knocking your door down to try and get some more information out of you.
Awesome, awesome.
All right. Nick, thank you so much, mate. It's been such a pleasure catching up.
Yeah, it's been awesome. Thanks for having me. I love what you're doing. Thank you for everyone who knows Jeremy was our leader here when we won the MLS Cup in 2021. So it wouldn't be where I'm at without everything you've done for me. So I love what you're doing now. Thanks for having me.
That was such a powerful conversation with Dr. Nick Caropino. Here are the 3 things that you can take away from today's episode. Number 1, pain is an opportunity. Every setback is a chance to build a better foundation and take ownership for your health. Number 2, stick to the fundamentals. Strength, mobility, nutrition, and sleep never go out of style. Keep them at the core of your approach. Number 3, keep doing the work. Real progress comes from consistency, whether you're in the gym, the office, or on the field. At Vitality Collective, this is exactly the kind of work we do, helping people build strength, resilience, and long-term vitality through world-class diagnostics, personalized planning, and ongoing coaching. If you'd like to learn more, visit www.vitality-collective.com. And if this episode resonated with you, please follow the show, leave a rating or a review, and share it with someone that you think might benefit. You can also stay connected with us on Instagram, YouTube, or LinkedIn at Vitality Collective Performance. Thanks for being here, and we'll see you next time.